Hi, and welcome back to the Grammar School podcast. Today we have with us Dr Myria Galazi. What are some traits in young people that you see now that you've been teaching that really stand out and you really think that will make a change when becoming doctors in the future?
I think being someone who is easy to adapt to changing situations, that's a person that will be able to cope with all the rapid changes that are going around us. I think the world is changing very fast. The way we learn, the information that we have to know is very rapidly changing. So someone who is able to adapt and explore all these new ways to learn is someone that I think will succeed a lot going forward. Hello, nice to meet you, Maria.
Nice to meet you. How are you?
I'm good. Thank you for the invitation today.
To get to know you better and also introduce yourself, so tell us some things about yourself, your career.
So I'm a medical oncologist by profession now. So I trained and I treat patients with cancer. I specialize in specific parts of oncology. But other than that, obviously, I'll tell you the details of how I got here. But other than that, I'm a mom. I've got two kids, and the last 3 years I live in Cyprus after spending 19 years in the UK doing my studies and my training.
Mm-hmm. That's great. So looking back to your university days, why did you choose oncology?
Oncology. So in a way, it chose me. I remember working in a clinical rotation where a lot of my colleagues mentioned that it was a specialty suited for me. It's the truth, and maybe a lot of you going into medicine will experience this when you're during university and training. You change decisions and you lots of aspects of medicine will fascinate you at different times of your training, but there will be some critical points during one rotation or during meeting maybe one patient, meeting some specific colleagues that will inspire you to do something. And I think during that oncology rotation, I also felt that the complexity of those cases, the interest and the advances in all the treatments that the patients were having, the deep communications that you develop with those patients was something that actually felt very fascinating and very normal for me to pursue and do in the end.
That's great. So even before that, how did you choose medicine? Like, what drove you to choosing this career path?
Obviously, a lot of us, we're usually good students, and medicine is one of those options that you have. But you need a lot more than that to decide to go into it. You need good mentors at school to guide you to make these decisions. But I was clearly, fascinated in biology, chemistry, and then realizing, starting to understand how the human body works was something that was very fascinating for me. And I had, a strong family background of 2 parent doctors at home who I could see them having impact in people's lives on a daily basis. Certainly my dad was someone that I feel has improved people's lives, and that was something that I wanted to do as well.
That's awesome. So what's one piece of advice someone gave you? Like you mentioned, good mentors are important when going into medicine. What's a piece of advice that someone gave you before going into medicine, or even during your university days, that young people could listen to and So before starting university, definitely what I would say to someone, and what other people have certainly told me, was it's a path where you have to be very hardworking and be very disciplined to carry it through. That's certainly one very right piece of advice that I was given, and I would give it back. But what I would also say to people now, I would say, just continue to be curious about things around you. Ask for people to give you feedback. And, I think the way that we will learn and you will learn will be very different. Just explore all those new ways and try to do something that's outside the normal path.
Nice. Do you also teach?
I do teach. I mean, obviously, as doctors, we become medical educators. So there will be opportunities on a day-to-day basis where we would teach a nurse. We will teach a junior doctor on the ward when we're seeing a patient together. So there's lots of, those opportunities where, we teach and we are taught by other more senior colleagues. And that's also invaluable. I think that's sometimes a lot more valuable than normal teaching, the ones we get on from a projector during a tutorial. But I do teach medical students as part of a structured course led by UNIC, and I teach them during their oncology rotation, which is a 7-week rotation where I teach them on breast and prostate cancer, which are the two main things that I practice now.
What are some traits in young people that you see now that you've been teaching that really stand out and you really think that will make a change when becoming doctors in the future?
Yeah. So I think being someone who is easy to adapt to changing situations, that's a person that, will be able to, cope with all the rapid changes that are going around us. I think the world is changing very fast. The way we learn, the information that we have to know is very rapidly changing. So someone who is able to adapt and, explore all these new ways to learn is someone that I think will succeed a lot going forward.
Great. How can one gain this trait? Like a student at our school wanting to go into medicine and wanting to make the most of it, what can they do?
So obviously, a lot of the qualities that you learn within a structured environment like school, like university, that's where you have to gain, the big depth of your knowledge. Mm-hmm. You have to spend, those 6 hard years where you learn and you have to pass exams to get the knowledge. And, reading and learning will allow you to be, to develop your critical thinking, to be able to judge yourself what would be something that would spark your interest in the future. So I think, being very disciplined, hardworking during university or school is very important to enable you when you come out of that to, be curious and continue to learn to achieve further things in the future. But the basis of everything is school and university. I would definitely go back to that and say that many, many times.
So how did the university or even school prepare you for the real world? Like the idea of being a doctor and actually being a doctor must be very different.
Yeah, and nothing prepares you 100%. And like I said, having, reading, learning, interacting with teachers, university professors will enable you to gain all the deep knowledge that you need. Then after that, of course, your personality will change during your clinical training, where you learn to adapt, where you learn to be resilient, where you gain all these personal qualities, and then allows you, when you find yourselves in different situations, to be able to cope with them. But nothing in reality prepares you. And I think it's just being open-minded and, seeing how other people, learning from other people as well. Maybe you don't get to do one mistake, but someone else does. And, you can critically analyze that and understand, that you shouldn't be in that situation. And that also allows you to learn. So it's just being curious and looking around you, what everyone does.
Great. So I think the main difference between school and then the real world, especially medicine, is that mostly in schools and during tests and exams, mistakes are costly and they're really things that may set you back. But I think in the future and in medicine, there are ways to learn and get better and evolve.
Yeah.
So now let's go into something different. So how do you balance your social life and being into research, teaching, everything.
Yeah. So actually having two roles within, the job is really, really important. So, of course, everything we do is very patient focused, and you cannot get away from that, and you shouldn't get away from that, because they're the focus of everything you do. And of course, there's times where you will spend a couple of hours with students and you will teach them, and that gives you a different perspective to the kind of job you do. And then, we have these meetings with the research department where, we talk about the collaborations we have with some other institutions, academic institutions, and that again gives you a different kind of perspective and balance to your work. But yeah, you have to also, at the end of the day, step back, make sure you rest, you exercise, you spend time with your family, and remember why you have to be well mentally, physically, to be able to deliver what you want to deliver on a day-to-day basis.
What are some difficulties that one may face during this attempt to balance everything, or even through medical school?
I think, like I said before, we live in a very fast-changing world, and there's a lot of demands from us on a day-to-day basis. And it's very easy for people, not in the medical career only, but in other fields, to feel that burnout of, having to deliver and having to be perfect in everything that they do. But yeah, I think, remembering that you should, keep very close relationships with your teams as well, people who work around you, people who understand, the difficulties that you're going through, will be the ones that will allow you to cope as well with the difficult parts of the day-to-day work.
So you would encourage someone to work on building like a good network and a good background, a good team, to keep them motivated?
Yeah, and I think my mentors were the people who always guided me, and a good mentor, will never tell you exactly what to do, but they will give you examples. And I remember, I still have 3-4 people that are very strongly in my mind, who have said specific things at specific times that enabled me to understand myself more and make my decisions, but just with bits of their guidance that they could see in me.
So you've mentioned multiple times during this interview that the world is changing fast, and I totally agree with that. And I think the way that you were taught and the way that I'm going to be taught, or even students younger than me, is going to be very different, especially due to the introduction of AI in medicine, in everything. Mm-hmm. How do you think we, the new generation, can use these technologies to our advantage to maybe get to your position, or to make research easier and maybe faster? So
yeah, I've been thinking about it, because like I said, I've got 2 young kids, and I think about how it will change the way they learn. I think the bulk of the knowledge is a lot more than it used to be, when I was learning things. So AI will definitely be there to help us, generate all the knowledge that we need to learn. And it will be an easy way to do a search, to find information that we need. But people should never forget that, discussing cases, discussing, problems that they have on a day-to-day basis, that will never be replaced by, AI. I think, developing critical thinking, having emotional intelligence to be able to, get to some decisions, that will never be replaced. But I think it will have, especially in medicine and in oncology, you have to be very specific, it will have a massive role. Treatments are changing every 6 months. There's new drugs, new information about mechanisms of how cancers evolve with time. And AI will be there to support all that knowledge and help us, with our patients, to give them more personalized, more individualized treatments. the approach of treating every cancer patient with the same chemotherapy drug is definitely something we don't do anymore, even now. And I think, to a molecular level, to a personalized level for each and one of our patients will help us. And I think it will help us, some of these platforms will help us make, a better diagnosis, maybe monitor our patients better. I think there will be a big role in that, changing our profession.
In the oncology department, especially with cancers, you've mentioned that they're evolving and they're differentiating really fast. So what is some ongoing research right now? What is going on in that field of medicine?
Definitely, we are immunotherapies established. So these are the novel drugs that, entered our protocols about 10 years ago now. They're established, but there's a lot of research about their combinations with other new treatments. So there's a group of drugs, we call them now antibody drug conjugates. So these are combined molecules of various targeted drugs with immunotherapy. So those are advancing a lot at the moment, and they're advancing in lots of different types of cancer. The aim is not just to improve, the outcomes. So when we talk about outcomes in oncology, it's always about our patients living a lot longer, but also living a lot longer better, with less side effects, with better quality of life. So there's a lot of research and a lot of advances with these new molecules. Other than that, of course, there's a very deep understanding of, we know that, two women with breast cancer, they don't really have the same breast cancer. We are able to, molecularly understand those cancers. We have more markers that can help us predict to which treatments they will respond better. So there's a lot of research to allow us to deliver treatments for our patients as much individualized as possible. So, like I said, the same two women with breast cancer might get two completely different treatment plans because of the knowledge that we will acquire in the next few years. And I think, again, since COVID, everyone's been talking about cancer vaccines a lot more. They are coming. The field of that technology is advancing a lot. So I think a lot of oncologists are very excited to see how that can genetically modify those cancers and, what long-term outcomes we can have from those treatments.
So you've mentioned COVID. Have you seen a difference in the approach people have towards doctors, even the families or the patients themselves?
I think in a way, obviously there were lots of bad things with COVID. And I think within oncology, for me personally, I was still working in London at that point. It was a time when, I felt that I was not doing my work very well. I never learned to communicate with my patients on the phone, delivering bad news on the phone, giving tough information or trying to assess a patient on the phone without physically seeing them. So, in oncology, it was a very difficult time. There's definitely, good things that we've kept. We've learned to use the virtual platforms a lot more. So, we do that a lot more in our daily practice. I think that a lot of the patients have also learned that they can contact their doctors a lot more easier since COVID. At least that's my perception. Before there was always a barrier to, you have to come to the hospital and see your doctor and your doctor will assess you. And that's an old traditional thing to do, to an extent very, very correct. And a lot of the things we have to do them face to face. I think a lot of patients, I feel, have kind of, they feel that it's a lot easier to kind of not have some of those boundaries in their doctor-patient relationship. And sometimes it might harm that relationship as well, because if you don't see someone physically, assess them clinically, maybe you don't do the right judgment. Or if you talk to a patient at 9 p.m. at night when you're not in your work environment, maybe you think in a different way. So there's a lot of things that have changed since COVID. I think mainly in terms of how we communicate.
Bad news. I think the oncology department is very difficult when it comes to an emotional level. Going myself into medicine, many people have said to me, like, are you ready for the bad news? Are you ready for people to die? Are you ready to see people suffer? How do you deal with that?
So yeah, I think that's the hardest thing of what we do, delivering bad news, but actually also being present in some people's most difficult times. Maybe you are sitting in a hospital room surrounded by all of their family, and you have to be part of what's going on there. I think it's ultimately, knowing what the research progress of these illnesses, knowing what's there to come for your next patients, participating in research, teaching other colleagues, to take part in what we do. I think these are the things that will help a doctor on a personal level cope a lot better. So it gives you a little bit back of your sanity, all these other aspects of the job. Yeah, and I think remembering why you chose to do it. I think remembering that, at the end of the day, you chose to do that job because you want to have that impact and that role in someone's life. And that ultimately you're the best qualified person to do it. So you have to keep your strength together and do it.
So you've worked both in the UK and in Cyprus. What are the differences that you might have come across either with the system or with the people?
So obviously, I worked in the NHS for 13 years, and all those 13 years was within a national health system. So coming to Cyprus for me was very natural to start working within a healthcare system that was established with some very similar standards in a way. I mean, obviously, the NHS is something that people respect a lot. It was founded in 1942. A big generation of people have benefited from that. It's something that people have a massive respect for, with its flaws, but they have a massive respect for. And that ultimately helps them respect their doctors a lot more. I think Cyprus definitely, we have a very different culture, we formed relationships differently. Again, this is part of our culture. So I think within a changing healthcare system, with a different, mentality of people, certainly I can see, big differences there. But ultimately, I believe that our current healthcare system is for the benefit of patients, especially oncology patients, that they need fast, rapid access to diagnosis, to free treatments. So yeah, I think both systems have their goods and bad aspects.
That's good, because most of the people, especially in Cyprus, they always ask for more from healthcare. But as you've mentioned, I think the system is really doing well.
Yeah. And I think we should, we should be the people, not just the doctors, but also the patients, to protect it. We have to be realistic about what we offer, what we demand. We have to protect it. If we don't protect it, we will not have it, and it will not be, for the benefit of our patients.
You've mentioned that it's important for you to have an impact, either for someone's life or generally in medicine. So what are some breakthroughs for medicine that really inspired you into going into your own research? Or even your department?
I mean, there were not specific breakthroughs, but obviously, I decided to go into research in 2013. That's when immunotherapy was in all headlines. We knew that all of the research was going to be focused on that. I think working alongside, experts in those fields of cancer treatment was something that inspired me, seeing how they do their job, how they think. Mentors were definitely people that inspired me to want to pursue that. There was not a specific breakthrough, but it was, through all of these experiences that I had, the realization that actually, understanding the research more will make you a much better doctor. And truly, that's the main thing that I gained from my PhD. I mean, I did not want to continue to pursue a career in academia, but I realized how much better I was in my clinical role because I had a much deeper understanding of the cells, of the molecules, of the things that you can't see with your eye. So yeah, ultimately, I think, and if someone asked me actually what was the best part of my training and my career, I think it was that, getting to the end of my PhD and realizing the things that I learned by being able to do both.
I love the way that you talk about academics, because you see them, like you're curious about them and you use them to make yourself better. While I think during school, because everything is so academically based and it's so packed and all these exams, for us it's just checklists. Okay, learn this, but I think there's more to that.
Yeah. And I think before I went on to do a PhD, I considered myself a scientist. And when I went to do a PhD, I realized I was not. I did not think as a scientist. I knew how to put a series of things together, put symptoms together, put some things that I saw, in investigations, and make a decision about a diagnosis, make a plan about a treatment. But I was not a scientist. I could not think about, the blood cells inside someone's body and what they do and what you want them to do. So they're two completely different things.
Now, for young people watching this podcast, maybe considering medicine and being unsure, because I think most of the people who want to go into medicine are influenced so badly from the people around them that have different opinions, either because it takes so long to finish, comparing it to other professions. So how can one really prepare and be certain that I'm doing medicine? Like, what's something that really helped you?
So you need to have an understanding of, the daily routine of a doctor. You definitely need to understand that, other than, being someone who would work hard, will not want to give up 2 years later. So it's very important to, spend time in clinical environments, see what a doctor does from 8:30 in the morning to 5 o'clock when they're about to leave their work, and understand that if actually you are someone that does not enjoy person relationships, will not be able to, do this profession. Because the medical school years, you read, you learn, but ultimately at the end of the day, what you will be doing is just being with people, whether that's your patients, whether that's a surgeon colleague, whether that's a pharmacist that will call you because, they want to discuss a treatment you've prescribed, whether that's a radiologist who's seen a scan. So your day-to-day routine is patient-facing, a person-facing. And if you are someone who does not enjoy that and prefers working in front of a computer, then, my biggest advice will be that, you're always looking at someone's face, you're talking to them, you're responding to their cues. You have to be someone who can, do this on a day-to-day basis.
So what does a daily routine? Like, I'm sure that every day is different, but like, what would an outline be?
Yeah. So yeah, there's no routine, and no day will follow the plan you want it to follow. But yeah, I mean, my initial half an hour will be just to check some investigations from the day before, things that I'm worried about, make sure that I act on some investigations that need to be acted on urgently, blood tests, scans. There might be some treatment plans that I want to finalize. And then, the rest, the majority of my day will be spent, in an outpatient clinic where there will be patients come to be seen. Some of them will be new, where they will have to hear some things from you for the very first time, and you have to give them a bit of a medium to long-term plan of what's going to happen to them. Some people who are already on treatment and they come and you have to assess their side effects or give them good or bad news. We also give very good news a lot of times. And lots of people who come on follow-up, because at the end of the day, if I talk about breast cancer specifically, 85% of our patients are cured. They go through a very tough treatment period, but the majority of them are cured. So, 8 years down the line, 10 years down the line, they're still coming for annual checkups. So you see those patients where, they continue their life normally. And then, on occasions, there will be patients who are on the ward. You have to go and see them. So those are the sickest patients. You have to give them treatment in hospital. There might be some of my patients who are having treatment in the chemotherapy suite. So I might need to go and check on how they are. And then 2 times a week, we have 2 big, what we call multidisciplinary meetings, where all of the whole team sits together and we discuss either all the new cases or the difficult cases. So, that's something that should be done in all, oncology institutions now, and we do it to make sure that, no patient gets a single person's opinion about their treatment, which is very important. And then, yes, I close my computer and go home, and you just have to, just step back, make sure that, you leave that behind and make sure you do everything else that's part of life.
Teamwork and communication seems to be like very important. So how would you advise someone who wants to go into medicine and is not really confident or really open to receiving comments from other people? Yeah. How should he or she work with that?
Yeah. So obviously, what you need to get into medicine is your good marks, your hard work, your discipline to work hard. I realized, and I was not, the most extrovert person at all. I realized that during medical school, a lot of the structured communication skills we used to do were there to really, really help you, explore those parts of your personality that you can't as a 16 or 18-year-old. You're mentored by people who are experts in leading you and guiding you to learn those communication skills. So I think taking the basis of, hardworking student, disciplined student who will be able to, read and pass the exams in a 6-year-long course, that a good medical school will be there to prepare them, to develop all those other aspects of personality. It also depends on, of course, where you do it and the city you do it. I mean, I remember, the first patients that I was interviewing in London with an Irish accent, and I could not understand what they said. And they could not understand me, and at the end of the day, you realize, diversity, being part of a diverse environment is what allows you to, go back and find those aspects in your personality, bring them out and help you, be more of an extrovert, more of a communicator. There's many aspects that will guide you there. But I think a medical school structure is very much
focused on doing that. We had similar, sorry, I'm just getting a bit more comfortable now, but we had very similar sessions in medical school like this, where there was a couch, there was 2 cameras, and there was an actor, and we had to take a history from them and examine them. And everyone else was sitting outside looking at you on a video. So you were inside, not feeling that someone was watching you. And then they had to make you look at yourself, do that. I used to hate doing that. But at the end of the day, you realize that part of your work is to take that role and do it. And then it just becomes very natural.
I think diversity is really important, because also in our school there's a lot of people, different ages, people from different backgrounds. So I think we work with that a lot.
And Cyprus is better now than when I was growing up in Cyprus.
Yes. So we've mentioned that it's important for a future doctor and a doctor to be resilient. So what are what is a challenge that you've faced that's really stuck in your mind?
If I have to answer that, I would say, as oncologists, we recognize some points that there are some points where, your treatments are actually probably harming your patient more than giving them a benefit. So we have some of those patients who have received treatments for years, and ultimately their bodies very weak, their cancer is no longer responding very well, and you have to decide to say to your patient that even though I have some drugs available, I should not, and I do not want to give them to you, because I would only do harm to you. A patient and their family most of the times will not understand that. They will wonder, why do you have treatments available for me and you don't want to offer them to me? And I found myself being challenged in these situations many times, and I know what the right thing to do is. And I realized that, with the majority of my patients, if you actually at the end of the day sit down and ask them what they want, and one patient said it to me, and then it stayed for me forever. He said to me, what I don't want you to take away from me is my hope. So if you're telling me you're not giving me something, you're taking away my hope. So I went on and treated someone based on that. And it's something that continues to challenge me. It's not a daily thing, but it's a frequent thing. And it challenges you whether you should give treatment to someone to offer them hope or to offer them an actual, proper outcome.
Yeah, that looks like a very hard challenge. How do you experience and how do you deal with the families getting involved? Because for us, cancer, just the thought of it, just the news, okay, your relative has cancer, in our minds, it's something really devastating, and really we're maybe hopeless, and then you really try to make yourself be okay. So how do you really inform families, especially you said that breast cancer is now treatable? Yeah. So how do you actually make them believe it?
Yeah. So, there's some people who want to know the facts. They like listening to numbers. They like listening at exactly how things are. And if you are a good doctor and you know those facts and you say to them in a very clear and straightforward way, then it's a perfect way to deliver, what you want to say. So we spend a lot of time with families. We give numbers, we give percentages, we explain, a course of a treatment plan if we know what's going to follow in a few months' time. I think when it comes to obviously delivering bad news or dealing with difficult emotions, then that's where, as an oncologist on your own, you can't do it. You need a team, and we have a team of psychologists. There's families where there's lots of dynamics to think about. There's families where some families have adult children caring about their parents, and they do have questions, but they're adults. Some families have young kids that they have to have an understanding of the situation. And really, as an oncologist on your own, you can't do it. You need a team. And I mean, again, it's good that there are a certain number of good teams in Cyprus for that, because families and family members need support.
What tips would you give a family member or someone involved with a patient, how to be supportive and also allow the doctor to do their job?
Yeah. So obviously the first thing comes from the trust that you develop from a doctor itself. So I always say to my patients, if you want to get a second opinion, get a second opinion, because if you hear the same thing from another colleague, then that's a very big confirmation for you, and it should never be taken as as something negative for the first doctor. Patients need to have your trust, and if they have your trust, then it will be a lot easier for them to deal with whatever you tell them and whatever you explain to them about what they're experiencing, what they're seeing. It will be a lot easier for them to deal with it. But yeah, we have to understand that they are the main carers. They are the ones who see those people on a 24-hour basis when it's a weekend and they can't contact someone. So yeah, there will be periods of them being in stressful situations where they might doubt what the medical profession is doing for them. So you just have to be open-minded and understanding. But ultimately, if they develop that trust to you from the beginning, that relationship is always easier going forward.
Have you had the family members saying, well, I read this on the internet, can't we do this?
All the time. And again, you just have to offer your best, knowledgeable answer. Most of the times you have it, you know what the answer is. If you don't know, then, say that clearly. And if I don't know something, I say, if I was in that place and someone told me they don't know, then I wouldn't do it, because if it's information that your doctor doesn't know, then you should not, take a risk yourself.
To finish this off, if a listener to this podcast was to go off with one piece of advice, either they're going into medicine or they are currently a medical student, what would you say?
I would say things that I've mentioned partly before already. I would say be curious. Always try to learn new things, learn from other people's mistakes, ask for feedback, and be surrounded by great mentors.
Great. Thank you so much. I think that this episode will really help people understand the importance of medicine, and that it's more than just treating, just learning off by heart biology and chemistry. It's really making this impact and being next to people and helping also through research. Medicine evolved. So thank you so much.
Thank you for having me here, and I wish you all the best, Maria.